Morning, Dr. Lipo, 39-year-old. I wish I was 39. He's 39-year-old male from Toronto, Canada, who flies here for my gynecomastia expertise. Now, he had surgery done already in Toronto, but really just gland removal only. Maybe they did a little lipo, but probably just gland removal. And you can see the concavity that he has. Now he weighs, what do you weigh?
190.
190, so 200 pounds. Were you heavier?
I was, yeah.
Yeah, you were like what,
215.
That's not that terrible. But put down the arm, you can kind of see kind of the droopiness and the excess fat. And we're doing everything. We're doing from neck to nuts and around the side. We're going to turn him on the side and get as much back here that we can. No gland. Lift up again. No gland to be removed. That's flat. Now this nipple popped out. This one kind of is sunken in. So let me see if I can just kind of snip that to release it a little bit. Because it's probably held there, pulled in by contracture from scar tissue from the muscle. We are going to do lipofilling, pectoral lipofilling. We are going to do Renuvion J-Plasma, and we're going to get a shitload of fat out of him. I think we're going to get 4 to 5 liters, hopefully, out of him. Sweet. Stealth incision, armpit, nipple, and inside the belly button, and way down in the groin to get this fupa. No tummy tuck, no mini tummy tuck. Can he use one? Maybe, but something. I kind of take that for people that want it. I will be giving him a nice six pack there. I think he deserves it, and I think some beautiful pectoral lipofilling we're going to get done. And last but not least, we're going to do Renuvion to tighten. He needs a lot of tightening. But last but not least, we're going to do a nipple areola lift to kind of get both of them up to a more appropriate level. But just make a muscle. You can see they're that's the muscle. When you make a muscle, they the pectoralis major muscle raises. So I need to get that up above there to get rid of this, get rid of that, get rid of that. We're just going to do them up. We're going to spend hours upon hours here. We're going to have fun. We're going to laugh. And we'll do it all. So Lipo Gyno, let's go. And we pump you up.
Yeah.
Yeah.
Hans and my friends, and we just want to pump you up.
Alright guys, so here we are. No glands, so not to worry about that. So what I'm doing is I'm vasering all the fat. This does tighten up the skin somewhat. But the Renuvion at the end tightens it up even more. Have muscle memory here where I put you. Alright, so we're melting the fat, and I'm also etching the muscles as we're doing this. Getting into this beautiful negative space here, okay? All right, guys. So now we do the magic. Magic. This is the magic. Lift up there, baby. Good. All right, so using a 4mm Mercedes long 40 centimeter cannula, which I bent 20 degrees. I'm going to probably use the 20 and the 30 degree bend on him. The 20 degree is just enough for this part. Then we get to the lower part, especially to the sides, I'll use the 30 degree bend. This allows me to get around corners and to shape beautifully. You okay?
Oh,
Nice.
doing good. Thanks.
You're doing great. So now we're in the nipple incision going down. Remember, he had Gynecomastia surgery in Toronto a couple years ago, and they just took out glands. If they did lipo, it was minimum. But here we're doing it right. One thing good, we don't have to take out his glands. That's one thing good. But we have to do a nipple lift and fat grafting in that area to compensate for all that stuff that's gone. All right, so now I'm on the contralateral nipple, and I'm just getting this semilunaris part of the nipple. Remember, got no gland, so I don't have to go underneath it, but we will be doing a nipple lift, so I need to preserve all that nice vascularity to the nipple there. Can't mess around with that. Can't mess around with that. Etch this midline here. You all right?
Okay.
Good.
Yeah.
.20-degree bend, I mean. So now I'm switching it to the 30-degree bend, so I can even get better around here to his back. Alright guys, so now we're doing Renuvion J-Plasma, and this is going to tighten them up. But we have to hit them hard with this, which we need to really tighten. Alright guys, so now we're doing the nipple areola lift. Not a reduction. We can do a nipple reduction, but his nipples are fine. He doesn't need a nipple reduction. We're just doing the nipple areola lift. And not a reduction of the areola, because that just, on males, it just doesn't work. They've tried, especially in the UK and in Canada, it doesn't work. So if you guys think your areolas are too big, have some idiot doctor do an areola reduction. It'll be twice the size. So I'm just cutting around the areola. In males, the areola shouldn't be as big as females. Females are usually 38 to 4 centimeters. Males should be smaller. Let's see what we make. This one's a little bit bigger from the previous. This is 3. It's about 2.75. Pectoral lipo filling. Open up a little bit. Good. I've already numbed them. So we're going to grab the muscle. Get right there. There we are. You right? Right under that muscle. There you go. Perfect. Boom. You okay? Dr. Lipo Gyno, 39-year-old gentleman from Toronto who had botched surgery done a couple of years ago. So he came to me, came to the best, and expecting the best. We did Vaser, high definition power assisted liposculpture, No glands. They were gone. They were overly resected back in Canada a couple years ago. But we did pectoral lipo filling and a nipple areola lift. We did stealth incisions in the armpit, by the nipple, inside the belly button, and in the groin, where the drains still exist. We did the six-pack abdomen, 246, the midline linea alba, the semilunaris. I sucked out a lot of fat from his fupa down to his hips and really turned him around and did a good part of his lower back. Again, as I said, we did a nipple areola lift. I etched and defined the pecs, the lats, the serratus muscles. We did it all, and we did 200 cc's of purified fat into each pectoralis major muscle to give him a Hercules Spartan chest. He looks absolutely amazing. Please compare his before and afters. So if you have gynecomastia, you want these extraordinary, absolute, perfect results, you call me Dr. Lipo, where I do the best to give you the best. Call me, Dr. Lipo, 631-424-0101, or email me at jonathanleibowitz@gmail.com. Just look at the work of art that I created. Make a little muscle. Look at that volume, suck in your belly. Look at that six-pack abdomen, suck in your lower belly. This is what I'm talking about.